Hi, my name is Scott. I'm a physical therapist assistant here at Northmore Orthopedics, and today I'm going to be talking to you about ankle sprains. So ankle sprains, we have 3 ligaments on the outside of our ankle and 1 large ligament on the inside of our ankle. Most sprains tend to happen on the outside of the ankle, however. And that is because when our ankles are at rest, they want to rest in a plantar flex and an inverted position. This is the best position that's most relaxed for the ankle. However, it's detrimental to us because a lot of athletes, when they go and jump, that ankle goes to that rested position and we land like that on our foot. And that causes ankle pain and swelling and a quick stretch on the ligaments that could actually maybe even possibly tear it. So we're going to be talking about ankle sprains, different exercises that we could do, and what to avoid. So this is Carolina. She's a physical therapist tech here with us. She's going to be assisting us with the exercises today. And I'm going to ask her to lay down because I'm going to show where ankle sprains most commonly occur. So that's going to be up in here, right around this bone on the side. We have 3 ligaments right around here that actually are what's responsible for when we get a sprained ankle, most likely, usually. So, like I said, the position, the ankle, it likes to rest in this position. Go ahead and just relax. And now that puts a little stretch on all of these. So what happens is when we sprain it, it's a very quick motion that causes a lot of inflammation up in here, and a lot of pain and a lot of swelling, possibly even bruising. So there's 3 different grades depending on what your doctor rates it as. And there's certain ways to go about treating this. First and foremost is after an ankle sprain, you want to avoid the mechanism of injury. So in this case, if you sprained your ankle in this direction, you want to avoid moving your ankle or forcing it in this direction. If you were to try with an ankle sprain, you're going to feel a very, very strong stretch and it's going to be very painful. So avoid it at all costs until a little bit later in the healing process. So another good technique you're going to be doing after an ankle sprain, you're going to be icing a lot. Ice is going to help decrease inflammation and as well as decrease pain. So you could be icing 6 times a day, 10 to 15 minutes each. And as you are icing, what you want to be doing is elevating this leg. You can bend the knee a little bit. You're going to be elevating the leg just like this, so that whatever you are elevating, in this case your ankle, is above your heart level. If you are not elevating above your heart level, you're not doing anything, because being above the heart level, gravity assists the fluids to kind of come down and be filtered out of the body properly. So there are a couple of decent exercises that we can do for an ankle sprain that avoid the mechanism of injury and still allow us to gain a little bit more range of motion than what we're allowed as far as our pain levels. So the first one, this is a strap. You can use a belt, dog leash, bed sheet at home. So the first one is a calf stretch. Our calf's in the back, right along here. What I'm going to be doing is she could be laying down or sitting for this, either or. And I'm going to have her gently pull. See, the strap is right at the ball of her foot. And her pulling with the ankle and leg nice and relaxed, she's getting a nice stretch all along the back. When she's doing this, she may feel a little bit of compression sensations up in the front or on the side of the ankle just because of all that swelling. You want to make sure that you're not forcing past any pain levels that you have and just kind of maintain within the pain-free or minor discomfort levels. She's going to be doing this 3 30-second holds or 10 10-second holds, depending on her preference. So what we need to be doing with an ankle sprain is working on our range of motion. However, as I keep reiterating, that we need to avoid the mechanism of injury. So with Carolina here, since she sprained her ankle right on the side, what I'm going to be having her do is she's going to be avoiding this direction. But she could go in all the other 3 directions. She could go up, just like this. She could do this 10 times when it gets easy, 20. She could go out, just like this. And then she could gently, very gently, go down. Again, she may even feel a little bit of a stretch doing this one. If she does, she needs to back off, stay in the pain-free range. If she can't find a pain-free range, then she'll just work going up and out to the outside. Again, 10 to 20 times in each direction. She can do this 1 to 2 a day. And when you're doing these, you want to avoid rotating that leg at all. So after about 2 to 3 weeks of letting everything kind of calm down in the ankle, we could begin gentle strengthening of the ankle, avoiding the mechanism of injury yet again. So she has the TheraBand right here. I'll be holding it right here, very gently. She's going to be bringing that toe up to her face. Good, and then back down. She can be doing these 10 times. You want to start easy, and then when they get pretty easy, you can bump it up to 2 sets of 10. And when she's done with this direction, she can go to the outside. Again, she's making sure that she's not rotating the rest of the leg. And then after 10 to 20 of these, she goes down very gently. Again, if she gets pain, she tries to back off, loses the TheraBand, just does it by herself. And if that again is still painful, she just stops that direction altogether. Good. And again, we are avoiding strengthening in this direction right now because we don't want to stress out this too much. You could, however, start to incorporate it eventually as your ankle starts to lose its swelling and get a little stronger altogether. So there are a couple more exercises that you could do, not regarding the ankle, however. You could do a lot of core exercises. Core is good to kind of stabilize up and down our chain. And we could also do a little bit of balance exercises later in the phases of healing for that ankle to kind of promote a little bit of stability through that ankle. Now, your doctor may prescribe a brace that is laced up around your ankle. Wear that as prescribed by your doctor. And when you're in PT, we might also opt to wrap your ankle with some ACE wrap or possibly kinesio tape for added support. Now make sure you are resting, icing, and elevating your leg to make sure that you control that swelling and pain levels. And if you continue to have issues with your ankle, please come in and see us at North Point Orthopedics. Thank you. Bye.